Welcome to this Cosmo-educational session. Today, we will explore key insights from the article titled The Interpersonal Core of Personality Pathology, published in the Journal of Personality Disorders in 2013. Hopwood and Pincus explain that several authors have stressed the clinical value of assessing both the general features that define personality pathology and distinguish people with and without personality disorder diagnoses, and the specific features that distinguish individuals with personality disorders from one another. Clinically, general features indicate the presence and severity of a personality disorder, while the specific features indicate how the personality disorder is likely to vary in its manifestation, contribute to dysfunction, and provide a basis for hypotheses about differential therapeutics. The distinction between the presence of personality pathology and the style of personality disorder is explicit but underdeveloped in the third and fourth editions of the Diagnostic and Statistical Manual of Mental Disorders, known as the DSM. In that model, a general definition provides the rationale for the Axis II classification of personality pathology, whereas a series of categorical diagnoses characterize stylistic variants of personality disorders. However, according to a subset of the DSM-5 Personality and Personality Disorder Workgroup, the DSM for conceptualization of personality disorders is largely uninformative on personality disorder commonalities, difficult to operationalize effectively, and nonspecific regarding the nature of personality dysfunctions. The DSM-5 workgroup therefore proposed a more specific and quantifiable definition of personality pathology involving dysfunction of the self, such as goal-directedness and identity, and in relation to others, such as empathy and intimacy. Although the workgroup's proposed DSM-5 definition of personality pathology offers a more coherent rationale for distinguishing personality pathology from mood, anxiety, neurodevelopmental, psychotic, and other kinds of disorders than that of the DSM-4, the American Psychiatric Association Board of Trustees voted to retain the DSM-4 personality disorder system unchanged in Section 2 of DSM-5. This proposal will appear in Section 3, which includes clinical constructs deemed worthy of further study. Hopwood and Pincus interpret the DSM-5 proposal from the perspective of contemporary interpersonal theory. Contemporary interpersonal theory aligns well with the DSM-5 proposal in its focus on mental representations of self and others in interpersonal situations. Hopwood and Pincus propose that the interpersonal approach adds to the theoretical texture, empirical support, and clinical utility of the DSM-5 definition of personality pathology. Fundamentally, personality pathology irritates and complicates day-to-day interpersonal situations and, over time, relationships. Although this impairment is pervasive and arises across situations and relationships, it is of central importance as it manifests clinically. For example, it is evident in the countertherapeutic behaviors of personality disordered patients, which contribute to the pessimistic attitudes of professional psychiatric staff, and in turn negatively impact the effective delivery of psychiatric treatments. The therapeutic relationship represents a central focus in most treatments designed for individuals with personality disorders. Innovative treatment developers have made accommodations that challenge theoretical dogma to address the interpersonal complications that come with treating individuals with personality disorders. For instance, although dialectical behavior therapy, or DBT, was developed as a cognitive behavioral treatment for borderline personality disorder, considerable efforts are made to leverage the relationship with the therapist as a primary contingency in highly articulated behavioral plans. Although interpersonal dysfunction is recognized as central to personality pathology across distinct theoretical models, interpersonal theory is unique in that it originated with the assumption that one should focus on interpersonal processes to understand pathological behavior. This assumption and the associated model of interpersonal structure and processes lead to concrete benefits for clinical conceptualization. The interpersonal situation is the fundamental unit of analysis in interpersonal theory. Interpersonal situations are events involving a self and other and associated with an affective experience. From an interpersonal perspective, the term interpersonal refers to what happens between actual people as well as what happens between mental representations of self and others. The affective valence associated with an interpersonal situation is a function of one's ability to satisfy basic motives for interpersonal security and self-esteem. Patterns of interpersonal situations, called dynamisms, develop through age-appropriate social learning. These dynamisms vary in their adaptivity and health, with some characterized by satisfaction of motives for security and self-esteem, and others associated with frustrated motives, manifesting as distress, dysregulation, distortions, and in severe cases, dissociation. These attributes reflect specific aspects of dysfunction that define personality pathology from an interpersonal perspective. Similar to the DSM-5 proposal's partitioning of self and interpersonal dysfunction, a basic assumption of interpersonal theory is that these elements can be effectively organized by the meta-concepts agency and communion. Agency refers to the condition of being a differentiated individual, manifested in strivings for power and mastery. Communion refers to the condition of being part of a larger social entity, manifested in strivings for intimacy, union, and solidarity with the larger entity. In contemporary interpersonal theory, agency and communion undergird the structure that forms the basis of a clinically flexible and extensively validated model for organizing and assessing interpersonal functioning, the interpersonal circumplex, or IPC. At the level of behavior, agency and communion vary along dominance submission and warmth-coldness respectively. A unique feature of the IPC is that variance from the center of the circle outward and variance around the perimeter of the circle are both informative. The distance of a behavior from the center of the circle indicates its extremity, or the intensity of an interpersonal behavior, motive, problem, or other feature. An extreme behavior is often pathological, as characterized by the kinds of behaviors arrayed around the circle. The placement of the behavior around the circle indicates its style, theme, or content. Contemporary interpersonal theory provides a system for assessing interpersonal functioning across psychological domains and at different levels of temporal resolution. This overall approach highlights the flexibility, range, and integrative potential of the IPC for conceptualizing personality pathology. The failure to achieve security and self-esteem in interpersonal situations causes dysregulation, which, when chronic and extreme, reflects personality pathology. In contemporary interpersonal theory, it is assumed that dysregulation can occur in one of three psychological domains: self, affect, and interpersonal field. Self-regulation involves the ability to effectively manage one's social cognition and self-concept. Affect regulation involves the ability to modulate one's inner emotional states and affective expression. Field regulation involves modulating the processes by which one relates to others in interpersonal transactions. Evidence of field dysregulation would include difficulties in developing feelings of intimacy and mutuality of regard for others. Sullivan proposed the concept of parataxic distortion to describe the influence of internal subjective interpersonal situations on observable interpersonal behavior. Parataxic distortions occur when one's mental representation of an interpersonal situation does not match an objective interpretation of the situation. The effects of distortions on interpersonal relations can take several forms, including chronic distortions of new interpersonal experiences, generation of rigid, extreme, and/or chronically non-normative interpersonal behavior, and the dominance of self-protective motives leading to the disconnection of interpersonal input and output. Healthy personality functioning can be defined in part by the capacity to organize and elaborate the data of interpersonal situations without distortions. Accurate social cognition promotes the mutual satisfaction of agentic and communal needs for both self and others. In contrast, when individuals have chronically distorted representations of self and others, failures to satisfy their basic psychological needs are common. Such individuals tend to bring these representations into new interpersonal situations, disturbing their ability to interact successfully with others. The interpersonal concepts of agency in communion, regulation, and distortion comprise the basic elements that structure interpersonal situations. The self includes both the self and affect systems, organized by underlying agentic and communal interpersonal motives that lead to behavioral styles, aversions, problems, and capabilities via social learning. The affect system, structured by affective arousal and valence, has a highly sensitive and dynamic relationship with the self system. The interpersonal field encapsulates the relationship between the self and others, who are perceived in terms of their agentic and communal behaviors and impacts. The specific input and output within the field are moderated by perceptual processes. Distortions and dysregulation generally present as coordinated indicators of personality pathology. Broadly speaking, behavioral transactions occur as a sequence of inputs from others in the interpersonal field, colored by perception, mediated by internal processes related to goal satisfaction and effective regulation, leading to interpersonal output that may or may not be adaptive. In specific interpersonal situations, interpersonal motives lead to the pursuit of proximal goals via particular patterns of agentic and communal cognition and behavior. This interpersonal behavior occurs within a field co-created with another person. The other's patterns of response vary in the degree to which they satisfy interpersonal motives, contributing to different affective experiences. Dysregulated or negative affects in interpersonal situations signal a disruption in the overall system. Such affects can be regulated via the interpersonal field or the self. Individuals with adaptive personalities can regulate themselves and achieve their proximal agentic and communal goals, regulate their affects, and perceive themselves and others more or less accurately. In contrast, individuals with personality pathology have a disturbed behavioral repertoire, often experiencing vulnerable and unstable self-states, negative affects, and engaging in maladaptive interpersonal behavior. Hopwood and Pincus have outlined the fundamental assumptions and constructs of contemporary interpersonal theory as they apply to the definition of personality pathology. In so doing, they suggest that understanding personality pathology from an interpersonal perspective has the potential to significantly enhance the clinical utility of the DSM-5 proposal. A research agenda that stems from the decision by the Board of Trustees of the American Psychiatric Association to retain the DSM-4 model of personality disorders in Section 2 of the DSM-5 while placing the personality and personality pathology workgroup proposal in Section 3 underscores the need for further research on the definition, description, and measurement of personality pathology. One of the most important innovations in the workgroup proposal is the recognition that personality is complex and must be broken down into clinically useful parts. This proposal provides a rubric for clinicians to rate the severity of personality pathology separately from the stylistic expression of that pathology using evidence-based and clinically rich assessment models. This distinction is clinically useful in mapping onto different kinds of clinical decisions, such as the level versus type of indicated treatment. A model with this level of clinical utility would stand in stark contrast to the Section 2 model, which has led to only a couple of evidence-based treatments for one of the 10 official disorders since it was established in the DSM-3 more than 30 years ago. Clearly, more research evaluating the clinical benefits of distinguishing personality disorder severity and style is needed. At a broader level, this division also maps onto a more fundamental diagnostic distinction between personality mechanisms and individual difference structures. Structural models provide a map of the variables important for conceptualizing pathological behavior but do not describe the nature of that behavior. Mechanistic variables that describe the nature of pathological behavior become tangible with reference to the kinds of behaviors that are dysfunctional. Any system focusing only on one set of these factors is necessarily limited. Thus, a positive outcome from the inclusion of the workgroup's proposal in DSM-5, Section 3, would be to promote more clinically useful research. Future research on personality pathology would benefit from using the DSM-5 Section 3 as a broad framework. Clinically useful innovations will be most likely if research focuses on aspects of self and interpersonal dysfunction that occur in interpersonal situations. Traditional methods in personality disorder research are poorly suited to answer these kinds of questions. Fortunately, increasingly popular methodologies, such as experience sampling, intensive repeated measures, and multi-method assessment designs hold considerable promise for developing insights into pathological personality mechanisms. These methods offer the promise of developing clinically rich, experience-near, and empirically valid models of what people with personality pathology do in relationships with others. In conclusion, Hopwood and Pincus have argued that the interpersonal situation is the psychological topography upon which the core features that define personality pathology play themselves out in daily life and in clinical interactions. Although many models attempt to cover this terrain, contemporary interpersonal theory provides the best available map of this landscape. The parameters of interpersonal situations reflect nomothetic dimensions validated by interpersonal research. Understanding personality pathology as fundamentally involving distortion of and dysregulation in both proximal and internal interpersonal situations provides a clinically useful and theoretically coherent means for demarcating personality pathology from other disorders. The promise of the DSM-5 proposal for redefining personality pathology is likely to be realized to the degree that it is augmented with evidence-based approaches to assessment and treatment found in contemporary interpersonal theory. Further synthesis of the comprehensive scope of interpersonal dispositions, dynamics, distortion, and dysregulation found in contemporary interpersonal theory would provide an empirically valid and clinically useful basis for justifying the migration of a revised DSM-5 proposal to Section 2 and replacing the untenable DSM-4 model. Thank you for joining us in this session.